So your health app is ready to change healthcare for good. It can improve patient outcomes, streamline clinical workflows, it can revolutionize billing. But to deliver on that promise, it needs to speak the language of the hospital. It needs to integrate with the electronic health record. For countless health systems worldwide, that's Cerner. And navigating a Cerner integration, well, it can feel like a complex maze of APIs, standards, compliance hurdles. We've seen it all. But take a breath. You're not alone. At OSP Labs, we've been guiding health tech companies through this exact maze for over 16 years. In this video, we'll walk you through the real process of integrating with Cerner. Not just the theory, but a practical path to success. And it all begins with access and understanding. Your first stop is the Cerner Open Developer Experience, the code program. This is your gateway to API documentation, sandbox environments, and all the tools you'll need. You'll be working primarily with modern FHIR APIs, the standard for healthcare data exchange. Cerner also supports SMART on FHIR, which lets you build apps that launch seamlessly inside the Cerner Millennium interface itself. And because we're dealing with protected health information, security is paramount. Everything is secured with OAuth 2.0 and strict authentication protocols. Getting this foundation right is critical. Now, let's talk about the development phase. This is where many teams encounter unexpected roadblocks. The sandbox is essential, but it has limitations. You'll need to navigate API rate limits and ensure your app can handle real-world, messy clinical data. The biggest challenges we see at OSP, one is data mapping. Translating between Cerner's complex data model and your app's model requires deep healthcare domain expertise. Two is compliance. This is non-negotiable. Every data exchange must be HIPAA compliant. This is where inexperienced teams can face serious risks. Three is system variability. No two Cerner implementations are exactly alike. Your integration needs to be resilient enough to handle these variations across different health systems. This phase is all about rigorous testing, building bulletproof error handling, and creating a connection that is not just functional, but also secure, robust, and clinically sound. Now, you've built it, tested it. You're ready to go live. Congrats. But in the world of EHR integration, launch isn't the finish line. It's the start of a long-term partnership. You must monitor performance, and you must absolutely be prepared for when Cerner and Oracle release API updates, because they will. And without a strategy for version management, your app and your client's critical workflows can break. This ongoing maintenance is precisely why you need a true healthcare integration partner, not just a generic development team. So why do so many health tech leaders choose OSP Labs as their Cerner integration specialist? It's because we speak healthcare. We're not just developers, we're healthcare interoperability experts. We understand clinical workflows, compliance mandates, and the business of medicine. We have a proven track record. We helped a mental health company automate their Cerner billing integration, and they saw a 55% reduction in claims losses. We built a remote patient monitoring solution that improved clinical outcomes for chronic patients by 65% through seamless data sync. We de-risk your project. Our experience means we anticipate challenges before they become problems. We have pre-built frameworks and accelerators that make the Cerner integration process faster, more secure, and more cost-effective for you. Integrating with Cerner is complex, but the value it unlocks for your customers and your business is immense. And you don't have to navigate this maze alone. Visit us at osplabs.com to see our more detailed case studies and schedule a free, no-obligation technical consultation. Let's discuss how we can turn your Cerner integration from a daunting challenge into your strongest competitive advantage. Thanks for watching.